what happens over time is basically we are fighting gravity. Our goal as healthcare practitioners is how can we prevent this as much as possible? Where should we intervene? Should we intervene here or should we intervene back here? Okay? It's kind of like, when should we intervene with heart disease? Before the heart attack or after the heart attack, you know? It's the same, yeah, it's the same thing with spine. The problem is our whole system of how we're basically taught in healthcare is you have to have a diagnosis. Like, in other words, you have to have something wrong. To have something wrong, a lot of times the tissue breaks down already. This is a problem because symptoms a lot of times don't occur until very late in the problem. I mean, as you all know, you might know that each one of us probably has cancer cells every day that your system, your immune system notices, takes notice, kills them, sucks them up, eats them up, and recycles the products. I mean, that happens every day, okay? So basically, most diseases that are killing us today are really causing a lot of disability: heart disease, strokes, diabetes, cancer, osteoporosis. All this kind of stuff is stuff that develops slowly over time. In fact, when do you know you have osteoporosis if you never have a test? Anybody? You don't? You actually, yeah.
I do.
Yeah.
Fact is, though,
What's that?
we as a people are living a lot longer than our parents and our previous parents.
Exactly. So the thing is, you know, us as healthcare practitioners go, okay, what are we going to do to make sure that this is better? And we'll get into some statistics on that. But our goal is to keep people at that stage, okay? Posture is really an important factor. This is the other thing that we think we're going to be able to address with this system. In this study, Glassman and his buddies in the journal Spine, they looked at basically how people look from the side and how far forward were they, okay? Anywhere from 1 millimeter to like 278 millimeters on like 400 people, whatever it was, they did the study. And every health status that they measured on these people declined the further forward they were, okay? So our goal is to get people to be able to stay upright, okay? You don't see too many 80-year-olds walking around like this, right? They're kind of like this, so we have to fight that. And the way one of the things we're going to try to do with our exercise system is fight gravity, basically, okay? So let's look at osteoporosis. It's a loss of bone. Everybody knows, pretty much have heard about that. It affects the entire human frame. I mean, it's the whole bone. It's like you are drained of the quantity of bone. You still have good quality, but you're draining the amount of bone you actually have in the system. Okay?
I'll lose weight then, shouldn't I?
No. No, that's a problem. So fractures commonly occur in the spine, hips, and wrist. 2/3 of the spinal fractures occur without presenting symptoms. In other words, you had no idea that you had osteoporosis. All of a sudden, bam, you know. People say, "Oh, my aunt fell and she broke her hip." Well, it's kind of actually the opposite way around. The hip broke and then you fell. Okay, and that's what we want to avoid. Okay, fractures occur often lead to disability, deformity, and death. Okay, so it has a tremendous impact. You have 10 million people have osteoporosis, 2 million of which are men. 34 million people have low bone mass. 40% of women over age 50 will suffer some osteoporosis-related fracture in their lifetimes, and each year the risk of suffering a fracture from osteoporosis is greater than the combined risk of suffering heart attack, stroke, or breast cancer in women. So it's a big problem, okay? But there's another problem. When you have osteoporosis, you generally might have gotten there because you actually might have sarcopenia, or you've heard of osteopenia, right? There's normal bone, and there's osteopenia, and then osteoporosis. Well, sarcopenia is a loss of muscle, okay? So a lot of times, if we're not moving the way we should, we tend to lose muscle. In fact, we lose half of our muscle and double our fat from age 20 to 60, okay? So muscle poverty is a huge problem, causes a lot of instability, loss of balance, because it's really our muscles that allow us to fight gravity. It's what allows us to stand upright, okay? You lose mobility and you lose function, and it's a big problem in the U.S. It adversely affects the quality and quantity of life, with greater risk of falls and accidents. And 50 to 90% of all calories are burned in the body are burned by the muscles. So what happens is our metabolic rate, the amount of energy we burn, actually goes down, and this is why we end up with more fat. Because what happens is we don't really think about it. We eat the same decade to decade, but we're like, why am I ate the same as I did, I haven't changed anything, but why am I getting fatter? And we don't even realize it's maybe because we're losing muscle mass, okay? So this is a big problem, okay? And again, it's muscles and our bones, our musculoskeletal system. That's okay. You want have it. You pull up a chair anywhere. So anyway, it's this muscle and bone system, our musculoskeletal system, that actually gives us our. This is where we get our quality of life, is how much can we function and move, right? And get things done and take care of ourselves, take care of family, whatever, do our hobbies, and be able to stay independent. I mean, that's kind of one of my things. I don't want my kids taking care of me. I don't want my kids having to take care of me as I get older, I'm just concerned whether they'll take good care of me. So anyway, the more independent I can be, the better off I am, okay? Look at falls, because this is the big thing. We start losing muscle mass, losing bone mass, so you're not as stable. You have to work harder to fight gravity. So we tend to lose stability, okay, because we're not moving as much. The other thing that happens when we don't move as much is your brain feeds off the information you get from gravity. Because right now, standing here, my body wants to go this way, then the nervous system senses that and it pulls me back here, then it wants to go this way. So you're constantly in flux, constantly, even though we look like we're still, your body's constantly fighting gravity or trying to maintain where you are in space. That's a constant feedback system. So if we move less over time, you get less of that feedback. So you start to lose coordination because of that, okay? So you can't separate bone, muscle, nerve, they all kind of work together. So it's real important to kind of address all aspects of it. But if we can maintain motion, we maintain more feedback to the brain, more impulses, sharper brain function too, okay? So movement's very important that way. So out of 3 adults age 65 and older, 1 out of 3 adults 65 and older falls each year, but less than half tell their doctor about it. Among older adults 65 and older, falls are the leading cause of injury, death. They also are the most common cause of non-fatal injuries and hospital admissions for trauma. So it's a big problem, and we see it here. I mean, we see people because they fall. I mean, in 2010, 2.3 million non-fatal falls injuries among older adults were treated in emergency rooms, and more than 662,000 of these patients were hospitalized. That's like a cost of over $30 billion a year. It's a lot of money.
You got superbug right now. You don't want to go to the hospital.
No, you don't. You want to stay out of there.
Ask you, my grandmother on my father's side was a small lady, but she was upright, working in her kitchen, and the steps fell, broke her hip. You say her hook may have already been broken.
The hip might have broke, which caused her to fall. That could have been, a lot of times that's what happens with osteoporosis.
They took her to Iowa City. She never returned home.
Yeah. Yeah, see, that's a
Now, is
common.
that more likely to happen today if the same accident happens?
Well, there's a higher percentage of that happening. It's not more today. It's probably not even less, because, I mean, it's common once they fall, what can happen is now everything's immobilized, so then they get clotting, and then you get clot goes to the lung, and they usually die of an embolism or a stroke, something like that's the complications we got to avoid. That's why right away, you have hip surgery, they get you up, you got to get moving. We can't have you laying in bed, blood clots. Well, especially if they're deconditioned. In other words, you've lost muscle already, so now you're even that much more prone to more. And that's what I was going to talk about here. Once you fall or you have osteoporosis and you have a fracture, and now you develop a fear of falling, okay, or a fear of imbalance and coordination. So what happens now? You move less. It becomes this downward. So when we actually have to try and move more, we can't do it because we're afraid. And so it's almost like you need to be trained. And this is one of the things why we're taking this on, because we see it a lot. I mean, I have a patient in my mind right now that I know I didn't have this available, and so it's like, wow, I wish I had it about 5 more years ago. I could have helped this person, you know what I mean? Anyway, so 20 to 30% of people who fall suffer moderate to severe injuries, lacerations, hip fractures, head traumas, and they can make it hard to get around or live independently, like I said, and it is a risk of early death, like we talked about, okay? So the patient then loses even more muscle, accumulates more fat, and further increasing heart disease risk and more falls, okay? So they're the most common cause of traumatic brain injuries, and in 2000, traumatic brain injuries accounted for 46% of all fatal falls among older people. In other words, they fell, hit their head, and they actually died, okay? Most fractures among older adults are caused by falls. Most common fractures are the spine, hip, forearm, you know, because you're protecting yourself with your wrist, leg, ankle, pelvis, upper arm, and hand. Many people who fall, even if they are not injured, develop a fear of falling. This is what I was talking about. This fear may cause them to limit their activities, which leads to reduced mobility, balance, and loss of physical fitness, and in turn increases their actual risk of falling. Okay, that's what we were talking about. It kind of like you get to where you lose that confidence in how mobile you are. Okay, so you know basically this is what we'll see of when that system's breaking down. We see more fatigue, you see more chronic pain and stiffness, less flexibility, you know, more difficult balance. You know, don't sleep as well. It's even tougher to take care of yourself, getting out of the bathtub, like personal hygiene stuff, because you can't take care of yourself the way you want. So it leads to more stress, anxiety, okay? You know, like I said, the feedback isn't as much as we would like because we're not moving as much, so you develop a little less creativity, you know, and productivity, loss of energy and motivation. So, and this is what we kind of talked about when we first started is, after age 60, we can expect to spend 25% of our remaining years with a serious disability. This is a thing, when I heard this back in the year 2000, I was like, wow, that really got me. I'm like, that's not good. I gotta do better for my patients. I mean, that's why I'm in this game, okay? So, even though, you know, we're living slightly longer, which we are, okay, and we have a, you know, and that's the thing, we recently have, and in conferences, have heard, we're gonna live the same length of time, whether we take care of ourselves or whether we don't.
You can do it standing up or laying down.
That's right. There you go. Bingo. That's the thing. Is we can keep people alive, but how much quality do we want to get out of that? Okay. So to get that quality, we actually got to put some energy into that. Okay. So even though we're living long, like I said, the actual quality of life is declining. Okay. So you have less ability to function on daily activities at home, personal care, and recreation. You know, and I don't want to give up my recreation. I mean, that's probably the thing for me that gets me. So is there a way to reverse bone loss and muscle loss without spending a lot of time while wearing, and I could do it while I'm wearing my street clothes. Like I don't have to be a gym rat. I don't have to go and spend 2 hours with nice jacket.
Oh, you like that?
Yes.
That's
Yes.
a good one.
That's good. Rangers, man. That's my team.
There
That's
you go.
good. That's good. Anyway, so without spending a lot of time, like, can you do it in a shorter period of time? Do I have to spend 2 hours a day, be on The Biggest Loser, and 4 hours a day, twice a day in the gym? Do I have to do that? No, you don't. That's the thing. The thing is, can we get it done in less time, you know, and we don't have to be decked out in our Nike gear to do it, okay? And you can. Yes, you can. We're going to talk about it now, okay? The big thing that can reverse it is to prevent that loss of bone, okay? You have to apply a maximum load on a regular basis to the musculoskeletal system. You have to stress it with a maximum amount of load to really reverse bone loss, okay? So this is what we're going to be able to do. Okay, and our like I said, our program is going to be called Be Strong for Life. We're basically going to apply cutting-edge exercise science with maximum exertion, okay, on a very short duration, okay? So if you apply maximum force, you don't have to do it for a long time. You just have to do it pretty much for 5 seconds for 4 exercises once a week, and we're showing data that they've actually reversed bone loss, like 4.5% on average over a 3-year period of return of bone, which is pretty cool. The problem is, doing maximum loading is not something you want to do without supervision or somewhere where you're not being instructed on how to do it, because you can hurt yourself, okay? It's a safe system regardless of age or fitness level, as long as you're being guided through it, okay? It's an optimal training for the least possible time with maximum benefit that you can apply throughout your lifetime, okay? And these are the tools that we use, okay, that we're going to be using. I should say we use. They've been purchased. They haven't been delivered yet. We only have one machine. The biodensity machine is here. we're waiting for our power plates, which is whole body vibration. These are units that when you stand on them, okay, they vibrate in 3 planes. They vibrate this way, they vibrate this way, and they vibrate up and down 2 to 4 millimeters. We can set that, okay? And it vibrates, well, probably between 30 and 50 cycles a second. So if we're going 40 cycles a second for 30 seconds, you got 1,200 muscle contractions occurring in a 30-second period, okay? So you're actually can really warm up your muscles very fast. The other thing is, you're using 95% of the muscle, okay? When I do a movement or an exercise, I'm generally only using like 25 to 40% of my muscle tissue, okay? When you do something on a power plate or a vibration unit like that, you're using 95% of the muscle, okay? Which is very important, because the more we can use that muscle, the more active it is, the stronger it's going to be. The other thing is you create more feedback to the brain, okay? So you increase the amount of signals going back and forth to the brain. The other thing is it takes muscles that have been chronically weak, that we haven't been able to turn on. For instance, like we see it in the spine a lot. It's the core muscles of the back and the upper back and the neck that are supposed to keep us stable, that we tend to lose. And they're the ones fighting gravity a lot. And what happens is when you develop degeneration or you have a disc problem or anything like that, or the disc is worn out, the muscles also atrophy in that area because the joint's not moving as good. And especially if the disc is, let's say, on one side, then the muscles on the other side will be the ones that atrophy. So what happens is we see the bone on x-ray, but we don't really see the muscle tissue, okay? But believe me, that ain't working as good either. But when we put people on a vibration plate, we can take these chronically turned off muscles and turn them back on, okay? And when we can turn them back on, then we can retrain them and make that spine stronger, okay? So the benefits really are improved balance and stability, increased flexibility and mobility, increased strength and endurance, prevent more injuries. If we're dealing with sports, if you go in like an NFL locker room these days, they got like dozens of these power plates lined up because they actually train on the vibration because they can do more activity in less time and train, get more effective training on. So you see this in a lot of sports teams use these. And improve sports performance, so like I said, decrease chronic pain and feeling better. I don't know about looking better, but I didn't do that slide. I thought I changed that. No, I can't. I'm like, I thought I changed that because I'm like, that don't sound right. I don't think it's going to make anybody look better. I mean, it hasn't helped me, you know. So, anyway, the way we're going to, there's going to be a few exercises we'll be doing. One, these will be things we will do to warm up people so that on the day that they do their biodensity, which is where we create the maximum force that you'll be doing once a week, okay? So we will use the power plates to warm you up for that activity. So we want you to do any other exercise you want and hobbies that you want, but on the if someone likes to lift weights, I wouldn't lift them a day or two before we do the biodensity or the day or two after, because you need recovery time to let the muscle rebuild, okay?
What is normal recovery time?
Well,
Let's say if you were lifting weights, you wanted a weightlifting regimen, and you wanted to give your muscles time to recover.
yeah.
I mean, what's the spread between that?
It really depends on the activity level. For this, we would only do once a week.
Okay.
Because we're playing, this machine doesn't move. We put you in, we find, a muscle has an optimum range where it's the strongest, right? So we find out pretty much within 2 to 3 degrees of where you should be. And we then apply a maximum load, which this machine measures your force, okay? So we get you in the optimum position so you can create the maximum amount of force that you possibly can. The machine measures it, stores it. Actually, the company stores the data. So they actually have all this data, over 200,000 pieces of data, probably close to 300 now, but this data I have here is about 200,000 pieces of data. And they'll store all four, so week to week we can monitor you. Okay, and I'll show you the results that they got for this. Now, if you're doing other kind of training, like weight training, probably 2-3 days, you know, you can work it again.
Okay.
This we would only do once a week.
Okay.
And we've had colleagues of mine that I'm dealing with, they've had, macho men come in and say, oh, isometric exercise, I could do it, it's not gonna be, I could do it tomorrow too, okay, come in tomorrow. Every day it gets less and less, their power goes down, because they just haven't let it recover. They think they can do it over and over, and you can't. So there's four major exercises that we call the Core 4, which will pretty much work every muscle in your body, and anybody can do this as long as there's certain things that once we take a history, we'll find out if we can't do it, like certain cardiovascular problems, but we will take a history to figure that out. So basically, you're placed in the system. The other thing we've done, the chiropractors have done, is we've modified the system because it didn't have the biomechanically correct postures. So we've actually waited for our seat to be delivered, different handles, so that we have people in the more optimal position. But they're placed in the system with our team, okay, and it allows you to generate maximum force. It's the force is self-applied, like you're creating the force. So that basically you're eliminating the risk of injury because you're the one controlling it, and no other product or system really can duplicate the same effect or achieve the same results for real storing the data also, which really is what we want over a long period of time, because what we're going to do is store this data with body composition data that we're going to measure on you. We're going to have postural x-rays, we'll have pictures to measure posture, and we're going to have questionnaires on quality of life that we can monitor people, because we really want to establish that like a healthcare regimen versus right now they want us to document everything we do, and did you help them with their pain, and how did that change their life? Well, we want to go, yeah, we changed life, and we're sustaining people over a long period of time. We just want to show that we can do better.
Who wants to know?
Well, no, nobody wants to know, but if we ever had to prove that what we do works, we have data, quality of life data, okay? But for insurance companies now, when they're paying, they want to know you're helping people, like Medicare. They don't even care about the pain. Did you improve that patient's function? That's what they really want to know. So we have to have quality of life data, and if it stabilizes and levels off, then that's it. They don't want to pay, that's it, they're done, okay? So it's kind of like, yeah, they don't pay you to eat broccoli, you know, they don't pay your gym membership, they don't want to pay that you can go to the chiropractor forever. I understand that, you know. I know, why not, right? I'm all for that, you know. So, anyway, this is kind of what we do. Very intense exercise, very short period of time, okay? If you're running a marathon, it's it's strenuous, but it's not as intense, okay? It's over a longer period. Even if you do a regular workout over a course of a few hours, right? It's a little more intense, but it's not enough to really reverse the bone loss, okay? You have to have maximum intensity in a short duration, okay? There's a difference between intensity and, you know, how hard, let's say, you might consider yourself working out. And so our goal over time, as far as the muscles are, these are myofibrils. These are actually like the cables in the muscle that contract, that allow you to move your arm, okay? What the biodensity system does is it actually increases the number of myofibrils so that you're actually, even though your muscle might not even look bigger, but it will be stronger, more intense, and we'll be able to measure that. There'll be more cables in there that'll be able to make it stronger, okay? And here's what we were talking about recovery. Usually a 4 to 6 day recovery period to make sure you build back the tissue that when you exercise, you basically are breaking down tissue. So you need protein to rebuild that and allow it to rebuild so that it's nice and healed up again, and then you stimulate it again.
Is that recovery time different for different ages?
Yeah. Well, no, muscle will recover. Muscle, if you're alive and you're breathing, basically, and you stress a muscle, it works as long as you give it food to repair. Yeah. So it's kind of neat because they've done studies on this where they looked at 80, 90-year-old people, even back, I think the book came out in 1992 or 94. It's called Biomarkers. You could buy it for like $1 on Amazon still. I checked the other day. These were the first guys that I saw do this. They basically took sedentary people in care facilities, made them exercise very hard, okay? They biopsied their muscle, looked at their muscle, they did all sorts of studies on them, and they changed their quality of life. These people were able to go to the restroom themselves, go up and down stairs, and they were able to rebuild muscle. What they showed was, no matter what age you carry, the body will adapt, okay? Which is really kind of cool. So, and they also found that muscle mass and strength were the number 1 and number 2, what they call biomarkers of healthy aging and vitality. So when we saw this, and you didn't have to be in the gym 3 days a week, which I hate being in the gym 3 days a week, or 4 days a week, I was like, wow, we gotta get this, okay? So, and then you can measure your performance over time, which is really cool, okay? Which is, that's important. You wanna see how you're doing. Am I improving? And it's not a straight line, You might be sick 1 week, so you're not gonna perform like you did the week before, or you worked in the garden and you're sore, whatever it is, But on average, what the results that they're seeing on over 200,000 pieces of data, their strength gains was about 75% in a year. Year 2, 141, year 3, 200%, year 4, average gains of almost 300% strength increase, and 94% of the people who start training using the technology continued to use it as they found long-term benefits, and they lived life with more independent function. It's like people who, it's kind of like you found out, brushing your teeth is good for you, so you do it every day, right? It's people, the colleagues that I know have done this, they said people really do respond. They feel much better, function better, and the doctors have told me that they have found that there's less chronic pain. So and you are stronger, joints will be more stable. So what can you expect? Really dramatic increases in strength without building bigger muscles. You're just building more dense muscles. Your improved metabolism, increased energy, improved bone density, and improved balance, function, focus, concentration. Like I said, you're going to have more stimulus going back and forth. Now, there is the third piece of equipment that we're getting. It's called the React Trainer, which really means Rapid Eccentric Anaerobic Core Trainer, okay? So we're going to use we would probably use this on a different day, but it would all be part of part of the program. And what this does, it actually makes the leg muscles contract while they're getting longer. So if I took this muscle, which is short, and I pull this way, I'm making it work as it gets longer. Well, this machine's we're gonna have you pretty much work. It's almost like you're skiing. The platform's gonna move while you stand on it with handrails, and we're gonna get to where you're gonna learn how to keep your body still while your legs move, almost like you're on a wave or.
So doing moguls.
Moguls. That's what it was used for. Was the U.S. ski team. And then you get crazy chiropractors who go, wow, that would be good for my patient.
Can I buy that mountain?
Yeah, we were like, no, I mean, seriously, I think there's like 60 of these machines in the country. One is owned by my football team, the New York Giants.
Did you buy it for them?
No, I didn't buy it, no way. I'm sure they can buy 2 or 3 or 5 of these things. But anyway, so we just thought, like, wow, this would be great, because now we can get them to really build strength around the legs, which is where we lose a lot of stability, while we teach them to balance their upper body, okay? So that's what we're going to use this for. And this is, again, you can't use this for a long period of time. You pretty much work on 1 to 3 minutes, maybe 5 minutes when you're like a real star at this, and you're gonna be working those muscles. And again, that's why we would do it on a different day that people would do the biodensity. But we feel the combination of the whole body vibration with the biodensity, with the React Trainer, that we'll really be able to improve people's balance, coordination, muscle strength, and bone density all in one program. So this is why we kind of got on board. So anyway, you can rapidly and safely increase leg muscle size strength while strengthening your core muscles, okay? It decreases your fall risk, easier to handle steps and stairs and uneven surfaces, because it's the going down the steps that gets hard, because when you land, it's the absorption of that force that these muscles have to do. They have to absorb it, and that's kind of where we start to lose that function, okay? Well, this will allow us to do that better. So it's really better in surfer. People will be able to get in and out of bathtubs better, even up and down off toilets, everything. Our goal is to get to where we can really maintain as much function as possible, okay? So really, we feel like it's the ultimate combination of technologies, that we can really apply mechanically to really dramatically improve the strength of the frame. And frankly, it's just something that I feel like we want to do more. Like, we help people a lot with what we're doing, but it's still something we're doing to the person, which that does not build muscle. It does activate the brain, but it doesn't build the muscle, okay? You got to actually move and stress muscle to build it. When we're moving it, we're we're stimulating your brain and getting joints moving, but it isn't building the muscle as much as we need to, so this is kind of why we wanted to add this. So we feel like we can improve function, you know, have less risk of falls and injuries, which, again, more independence over a longer period of time, okay? That's pretty much it. I mean, obviously, we talked about why we're doing this already. And this was really our goal here with people is we want to take this as kind of the curve where life takes us now, right? It's kind of like I have people every day, 30, 40, 50, 60 years old, 70 years old, you know, I'm getting old. I'm like, well, you're 30, the 7-year-old lady just told me that. I mean, you're only 30. But we start to feel, everybody tells us that, right? So it's like every ache and pain, we call it old age. Well, really, is it because we just haven't really applied the right principles to maintain the quality of life that we deserve, or we can have, I should say. And this is kind of where we want to take people. So if we can get to what we call maintain the quality of life, or the curve of life, longer, and compress the amount of disability into a shorter period of time, you know, at the end of life, that's kind of what our goal is, okay? That's what most people's goal is, but we don't really have a plan. We don't really know how to do it, you know? But I think we're getting closer, obviously, the more stuff we learn. So this has always been always been our framework, and we feel like we're fitting more of the pieces of the puzzle in to do
Well,
that.
that's the end down there, huh?
That is the end. You know what? And guess what? Where it's all, life is terminal, you know?
Everybody has an end.
Yes, yes.
Everybody has
We just
a-
want to go out guns a-blazing,
Just don't like
you
it.
know?
We all have an expiration date.
Right, exactly.
I
Exactly.
plan to
Go on
live
to
forever,
bed,
so
go
far
on.
so good.
Yeah, there you go.
I always envy people that just walk along and boom, they're dead.
Well, like the guy in the sinkhole.
Yeah.
Oh.
Yeah, that guy went, he
That
went to
wasn't
bed.
his, that wasn't his fault, but, yeah. No, but seriously, that's,
37?
what's that?
He was only 37.
Yeah, it's a shame. I mean, yeah,
That's ironic.
That'd be a nightmare.
that would be, I mean,
He had no expectation that he was gonna get up that
no, but, like you said, sudden cardiac death, things like that, that's what I'm saying, like, if we don't take an active role, like that, our disease processes today, they have no symptoms, and boom, you know, all of a sudden we got this or that, or we die, okay, and so should we wait for those symptoms, or, and this has always been the thing, how much what do I gotta do to make that, to allow that not to happen, and this is kind of one of the things that we feel is a piece of the puzzle. So if you are interested, we do have a sign-up sheet where you can get assessed. What we're gonna do is a complete assessment. We do like to see x-rays. We will probably, if we have missing data, let's say, we wanna kinda see the whole thing, so we can kinda see, especially from the side. Our software doesn't do it yet, but we're about to upgrade, where we'll be able to see your whole spine, kinda stitch together our pictures, so that we'll be able to see where you are, and let's say I'm just saying, you start here, right, and 2 years later, we take a picture, and now you're here, you see what I mean? That's kind of what we're after, you know, so we like to collect this data to see how we're gonna do, between pictures, x-ray, we're gonna do another movement analysis, squat analysis, some questionnaires, physical exam, you know, just to kind of find out where everybody's at and whether they can do this or not. Most people can qualify. There's a few things that are absolute contraindications, but most people, the oldest person I've seen do this system is 92 years old, so it can be done. So if you are interested, we have a sign-up sheet at the front desk, and start training as soon as we get started, we'll let you know, and be consistent, you know, and you know, follow the directions of the team, and that's pretty much it.